Today's webinar is being presented by Claire Schutte, our staff psychologist at the Johnson Center for Child Health and Development. She graduated with honors from the University of Florida with a Bachelor in Science in Psychology and a minor in General Education. She completed graduate training at Florida Institute of Technology, completing a doctoral degree in clinical psychology and a master's degree in applied behavioral analysis. Dr. Schutte has treated a diverse population of children, adolescents, and adults in a variety of clinical settings, including community clinics, college counseling centers, psychiatric hospitals, private practice, and private treatment programs. She has extensive experience in the area of child and adult psychological evaluation and assessment, and recently completed a postdoctoral residency in psychological evaluation. Her graduate training led Dr. Schutte to discover an interest in helping individuals with autism and developmental disorders. She has provided individual therapy, group therapy, and social skills training to individuals on the autism spectrum, and is excited to continue helping those with autism and related disorders by providing psychological evaluations at the Johnson Center. Before we begin the presentation, please note that questions can be typed into your control panel throughout the presentation, and, time permitting, they will be addressed at the end of the presentation. Now please welcome Dr. Schutte.
Thank you for the introduction, Nisi, and thank you all for joining me this afternoon. Today I'm excited to talk with you about meeting the needs of siblings of children with autism. As Nisi mentioned, this is part one of a two-part series, so make sure to tune in to part two of the webinar series. So a quick overview of what we're going to be covering today. Part one, what we'll be talking about today, I'm going to start with a summary of relevant research regarding siblings' experiences of having a brother or sister with autism. I'm going to be focusing on developmental stages and developmental issues because these are important in terms of how siblings are able to understand autism, as well as particular issues or challenges that might arise at different developmental stages. I'll be talking about the unique experiences, needs, and challenges that siblings often face when they have a brother or sister with autism. And a quick note, this seminar will be focusing mostly on siblings of children with autism. However, a lot of what we discussed today can also be applied to siblings of children with other special needs. Part two of this webinar series will focus more on specific strategies and coping skills for supporting healthy family and sibling relationships. So I'm going to be discussing more of common experiences and challenges that siblings often might face. And then part two is going to come in and talk about the important issue of how to cope with those challenges and experiences. Gina Martinez, our certified child life specialist, she'll be also talking about specific scenarios that families might face and how to navigate these. So make sure, again, to tune into the part two of this webinar series on May 21st at the same time at noon. So a quick review of what research shows regarding siblings' experiences of having a brother or sister with autism. There's somewhat mixed results in terms of what research shows. Many studies support siblings having positive adjustments and overall resiliency in terms of having a brother or sister with autism, whereas other studies suggest particular difficulties such as concern about the future, loneliness, and problem behaviors. Additionally, studies show that siblings of children with autism compared to siblings of children with other disabilities, and also compared to siblings of typically developing children, indicates that having a sibling with autism presents with unique challenges, such as behavioral challenges and internalizing problems such as anxiety, worries, fears, and things like that. Some research also shows that there's particular risk factors related to negative adjustments of siblings. These risk factors are things such as socioeconomic status, marital satisfaction of parents, the number of siblings with special needs in the family, as well as other family stressors. If you're interested in learning more about research, I have some slides at the end of the presentation that have some research references and articles there. So basically, what research tells us is that some children do adjust well. However, many siblings do face particular challenges or may be at risk to have particular challenges related to having a brother or sister with autism. So overall, parents should be prepared for these potential difficulties and aware of how their unique child is adjusting. Not every child is going to adjust in the same way. So some things to remember before we jump into more material is that all children are different. Like I said, some children are going to have a harder time than others. Some adjust quite well. Some siblings might be more prone to challenges such as a propensity towards anxiety or a higher risk of developing an autism spectrum disorder or other developmental disorder themselves. And again, this presentation is going to focus more on the potential challenges so that parents and professionals can be aware and prepared regarding these potential challenges that siblings of children with autism might face. So understanding of autism is a big area where siblings often struggle. Understanding of autism is going to vary according to the age of the child. A child who's 4, their understanding of autism is going to be much different than a child who is 10. Explanations about what autism is should start early and happen often. An explanation should also be age appropriate. So when we move forward in a few more slides, I've broken them up into different developmental stages because you want, to explain autism in a developmentally appropriate way. It's important to keep communication regarding autism, to keep it open and to check in regularly, not just to have one conversation about it and then let it go. It should be an open and reoccurring conversation. And it's important to remember that a factual understanding of what autism is and emotional acceptance are different processes. So a child might be able to understand the facts about autism, but it might take them longer to really emotionally accept what's going on with their brother or sister. So now, like I said, I'm going to walk us through some different developmental stages. I've broken it up into early childhood, middle childhood, and adolescence and young adulthood. So when we're talking about younger children, I'm referring to children between the ages of about 4 to 8. An understanding of autism in early childhood, you really want to make sure your explanations of autism are very simple, concrete, and factual. Siblings at this age, around 4 to 8 years old, their understanding is going to be based more on what they see and experience rather than logic. So their understanding is really going to be based on what they see and observe with their brother or sister. Younger children have trouble understanding the actual term autism, but they can understand more concrete explanations of behaviors. So let's see what some of those more concrete explanations would look like. So here's some examples here of what some of those concrete examples might sound like. Autism makes Joey play differently than other kids and makes it hard for him to talk. As you can see, that's a pretty simple explanation, and it's more based on what the sibling might observe in their brother or sister's behavior. Another example might be he waves his hands because that's what he does when he's excited. Or sometimes he throws things because he gets upset and can't tell us why. So again, you can see these examples are more concrete and basic and more based kind of like on behavioral observations that the sibling might observe in their brother or sister with autism. Again, younger children are going to have more trouble understanding the term autism, but they can understand more descriptions of their brothers or sisters' behavior. Some special issues or challenges that children who are more in that early childhood range might face. A lot of times, younger siblings are going to have expectations regarding play with their brother or sister with autism. Siblings are going to want to play together, and they might wonder, why won't my brother or sister play with me? And that can be very frustrating. They might have difficulty knowing how to communicate with their brother or sister. For example, if their brother or sister doesn't have much language or is nonverbal, it can be a challenge for them to know how to communicate with them. And they'll need some help and guidance from parents in terms of understanding how to do so. Younger siblings are prone to fear some more of the unpredictable behaviors. For example, if their brother or sister has a propensity towards aggression, or if they might get really loud sometimes, that can be scary to younger siblings if they're not quite used to it yet. Younger children oftentimes worry that autism might be contagious, like they might have autism too, or what does this mean for me? Or they might have fear that they did something to cause it. Jealousy is also common, particularly because of the amount of attention that children with autism need. Siblings, it's very common and understandable that they might have some jealousy regarding the attention that their brother or sister gets. And even younger siblings can fall into that caretaker role, and they might, overly take care of their brother or sister with autism or kind of act for them or talk for them. Siblings might worry that something is wrong with them. Younger siblings are likely to express their feelings more through behavior than verbally. Younger children, again, are going to have more trouble verbally expressing themselves, and you might see more of their emotions through acting out, them being more reserved or quiet, or changes in their sleep or eating behaviors. So they might not always be able to tell you how they're feeling. They might show it more through their behavior. Younger siblings are also prone to mimic or copy some of the behaviors of the sibling. So they might start imitating meltdown behavior, for example, or repetitive speech, things like that. It's important for younger siblings, for parents and professionals to be aware of any developmental delays in the sibling or related symptoms. Just to keep an eye out and make sure, that the sibling is also developing typically. So again, these are all kind of special issues or challenges that younger siblings might face. And again, stay tuned for part 2, because part 2 is going to review coping strategies and how to kind of strategies to deal with these challenges and to support siblings in these challenges. Moving on to middle childhood, so this would be children from ages about 8 to 12. In terms of understanding of autism at this age, siblings are better able to understand facts about autism. It's important to start helping the sibling understand that autism is enduring. It's not something that's necessarily just going to disappear. It's not something that their brother or sister caught, like a cold or the flu, that's going to go away. Um, Siblings at this age, they're better able to connect current events to past events, such as implications or possibilities. So, for example, a parent might say, Joey might have trouble going with you to your soccer game because it's noisy and he doesn't like loud noise. Remember when last time, so you can talk about previous situations that the sibling experiences and helping the sibling understand how they might be able to predict future behavior of their brother or sister. So siblings in the middle childhood range are going to be better able to predict and connect past events to future events. Okay, let's see here. So a few examples of what, talking about autism might look like for a sibling in middle childhood. Autism causes trouble with talking, playing, and understanding other people's feelings. Or your brother or sister needs a lot of help from special doctors so he can feel better, talk, and play better. So again, this is more, if you compare these examples to those for younger childhood, these aren't just behavioral observations. These are talking a little bit more about facts related to what autism is and how it might affect their brother or sister. So some special issues or challenges that siblings in the middle childhood range might face. Again, looking at ages from about 8 to 12 or so. Siblings in this age range might start to feel some resentment, embarrassment, and more difficult emotions regarding their brother or sister with autism. They may start to take some of their siblings' behavior personally. Again, that caretaker role can come into play for siblings of all ages. So they might feel the need to really take care of their brother or sister with autism and be almost like a younger parent. Children at this age are typically more aware of parental stress, and they might have a less heroic or invincible view of their parents. And it's okay for parents to acknowledge that they aren't perfect to siblings of this age. Peers are much more influential at this age. Um, Siblings are going to care more about what their peers think, and they might worry about how to explain autism to their peers. At this age, siblings are starting to form more of their own independence, and it's important to help foster this. So moving into adolescence and young adulthood, this would be siblings of around the age of 12 and up. Siblings are going to be much better able to understand things like the physiology and abstract concepts related to autism and what it is. They're going to be better able to discuss more broad topics, such as possible causes, current research, and the future. Um, Siblings at this age can reason more logically about past and future events. They're likely going to desire more detailed explanations and um, more factual explanations. And they'll move more towards acknowledging what autism means for them, what it means for their brother or sister, and what it means for their unique family. And some special issues and challenges that adolescents and young adults might face. Um, Again, peer issues are much more pertinent at this age. Siblings who are in the adolescent and young adulthood range have much more reliance on peers and more concern typically about what they think. They're going to be going through more of their own identity formation and finding out who they are as a person. They're going to have more awareness of others' reactions to their brother or sister with autism. And sometimes there can be conflicts between their own independence and maintaining a relationship with the sibling. So wanting to do things on their own, but maybe feeling a little tied towards taking care of their brother or sister. Some siblings in this age range might feel some resentment regarding their degree of responsibility, um, or even guilt, if they are kind of torn between wanting that independence, but also feeling responsibility. It's common during this age to start worrying about the future and what will happen to their brother or sister with autism, who will take care of them, um, as well as worry about how others will treat and accept their sibling. It can be common for siblings in this age range to make self sacrifices and over identify with the caregiver role. So, again, these are the potential challenges that siblings are going to be faced with in these different age groups. And make sure to stay tuned for part 2 for a discussion on different strategies and coping skills to help support siblings. So here's a quick quote. This is from the book Siblings, The Autism Spectrum Through Our Eyes. Christopher Castaldi Mulder, he's age 10, he said, "Sometimes I feel as if I'll have to take care of him when I grow up. I've asked my mother about that, and she hopes that William will be able to take care of himself one day." But this is just a quote that shows that a lot of times siblings, especially as they get older, will worry about who will take care of their brother or sister and what will happen then. So now I'm going to just walk us through some specific areas and changes that families typically might have to face at some point. Um, this first area is the topic of play. So a lot of siblings are going to wonder, why won't my brother or sister play with me? Siblings want to play with their brothers or sisters, um, but their brothers or sisters' autism can affect their desire or their ability to play due to things like restricted interests, social difficulties, sensory issues, and things like that. It can be difficult for siblings to find a shared interest or a shared activity that both of them enjoy. And this, especially for younger children, can be confusing. And it can lead to fights, arguments, loneliness, and other difficulties. Changes in family life are really unavoidable when the family is affected by autism. Some changes that families are likely to experience are difficulties keeping a family routine. Um, it's very difficult to avoid stress. So, a lot of times, there's an overall level of family stress that might, um, be more intense at times than others. But a lot of times, siblings witness their parents' stress or distress. Another big change to the family is that parents' attention a lot of times has to go often towards the brother or sister with autism because they do, children with autism do have a lot of unique needs, and it's unavoidable that a lot of attention goes towards the brother or sister. But this can be very difficult for siblings. The family can also experience difficulty being able to go to certain places or do certain things. For example, a family trip to the theme park might be hard to accomplish, and siblings might feel left out compared to their peers in terms of being able to do some of those activities. meltdowns and challenging behaviors of the child with autism can create a lot of disruption in the family and disruption in typical routines. Um, Siblings sometimes have trouble sleeping because their brother or sister might be waking up frequently throughout the night. Um, a lot of times families have to relocate to be closer to certain services for the brother or sister with autism. Siblings commonly have to attend a lot of doctor's visits and a lot of therapy appointments. Sometimes therapy appointments are included in the home, and that can feel really kind of funny for or weird for siblings having therapists come into the home and into their space, and that can really affect them. Um, and oftentimes there's changes in family diet. So if a brother or sister with autism has certain dietary restrictions or is on a particular diet, a lot of times the whole family changes their diet, which in turn can impact the sibling as well. Um, so having a child with autism in the family can create a lot of these changes that we just went over. Here's another quote. This is from Maya Cassandra King. She's age 10. And again, this is from the book Siblings, the Autism Spectrum Through Our Eyes. She says, the whole place was so unfair to me. Thinking about the place makes me boil bright red inside. Jordan got to play in plastic ball pits and go on big swings and do all these incredible playground things with a woman specializing in autism. Where was I during this? I was sitting on an old couch reading boring books or playing stupid waiting room games. So this is a clear depiction of how siblings often feel when they have to go along to all of these therapy appointments and doctor's appointments. They can be really boring and a drag to many siblings, as Cassandra says here. These next few slides are going to talk about some difficult feelings and emotions that siblings who have brothers or sisters with autism might face. Um, Guilt. Siblings might have guilt that they did something to harm their brother or sister, or possibly that they add stress to the family somehow if something happens. They might feel resentment, for example, towards the attention that their brother or sister might get. Siblings might feel isolated. They might feel like they're the only ones that have to have these experiences. Again, jealousy, commonly, regarding the amount of attention their brother or sister might get. Some siblings might feel embarrassed, particularly when out in public or around their peers, if their brother or sister with autism does something that attracts a lot of attention, for example. Siblings might struggle with feeling a lack of connection with their sibling. Um, they might have a lot of worry or anxiety regarding how their siblings or how their brother or sister is doing, or how autism is impacting their family. Some siblings might experience some depressive symptoms, and they might have thoughts such as, do my parents love me as much? Again, these are just some potential difficult feelings and emotions that siblings might face. Not all siblings are going to experience all of these, but it's important for parents and professionals to be aware of some of the difficult feelings and emotions that siblings might face. It's also important to know that siblings might have difficulty openly expressing their feelings and emotions, and you might see them expressed more through externalizing behaviors, which would be things like acting out or aggression, um, or internalizing behaviors or symptoms. So these would be things like a lot of fear or worry, anxiety, sadness, um, things that aren't necessarily behavioral expressions. A lot of times siblings might have worry about expressing their feelings because they might not want to add more stress or worry to their parents. So they might think, I don't want to talk to mom about this because she's already, stressed and worried about Joey. So it's better if I just don't tell her because I don't want her to worry anymore. Um, And having a brother or sister with autism can a lot of times feel isolating to siblings, and they might feel that they're the only ones that feel this way. Um, and it can be difficult to find a support network so that they can connect with other siblings that might have similar experiences. Um, And it's important because siblings might not necessarily know how to cope with their feelings or how to communicate them. So it's important for parents and professionals to learn strategies of how to facilitate and how to help siblings express their feelings in a healthy way and feel comfortable communicating them. And that's again why that open communication in the family or within the family is very important. And for parents to check in with the siblings regularly about how they're doing, even if they seem like they're doing pretty good. So I'd like to just real quickly go over some signs or symptoms of anxiety and depression in children, just so that parents and professionals can be aware of what to look for in case a sibling is having a particularly challenging time. So, some signs of anxiety in children would be things like stomach problems or appetite change, um, symptoms of panic, such as panic attacks, them complaining of feeling shaky or their heart's beating really fast, or being very fearful, um, or if they're expressing a lot of frequent worried thoughts, having difficulty engaging in activities due to these worried thoughts or fears, frequent nightmares, separation difficulty, changes in sleep patterns such as difficulty sleeping or much more sleep, or changes in school performance. Um, so, usually it's signaled by several of these things and changes in behavior and emotion. Um, some things to look for in terms of depression in children would be changes, again, in sleep or appetite, expressions of helplessness or hopelessness, irritability, trouble concentrating or making decisions, a lack of interest in typically enjoyed activities. So if they just don't really seem to want to do things that they used to really enjoy. Social withdrawal, conduct problems, low self-esteem, changes in school performance, or decreased um, self-esteem. I mentioned that above. So again, if your child or if you see a child exhibit, any a multitude of these symptoms or major changes in behavior or emotion, it's good to seek professional help and support in those situations. And again, not all siblings of children with autism are going to experience anxiety or depression, but it's just important to be aware of what some of those signs are in case they do. So we talked about the caregiver role when we were going through the different developmental stages earlier. But this is a particular area that siblings often face. Siblings of children with special needs are typically mature beyond their years. Um, Younger children or younger siblings might act and answer for their sibling. So they might kind of try to do everything for their sibling. A lot of times siblings support caregiving, so they support their parents in taking care of their brother or sister. It's important to maintain awareness and boundaries regarding how much the sibling is responsible for. And if you do find the sibling kind of overly identifying with the caregiving role, to help break that pattern a little bit. It's okay for them to take care of their brother or sister, but you just want to make sure that they're also, focusing on themselves and their separate identity. Siblings need to be kids too. Um, it's important for parents to support their independence, and to be open about concerns regarding the future and who will care for the sibling. Um, Peer issues are also very pertinent, especially for that middle and adolescent childhood periods. Siblings are at risk for teasing or bullying. They might get teased regarding their brother or sister with autism, and that can be really hard. Or they might witness their brother or sister with autism getting teased or bullied. They might feel some embarrassment, and they might feel the need to defend or protect their sibling. Um, Siblings also struggle with understanding how to explain and if they should explain autism to their peers. They might feel that no one else understands them. Their brother or sister might interrupt their play or interactions with peers. So siblings might, not want to have kids over to the house because their brother or sister, they might feel that they get in the way, or it's hard, for them to have their time separately with their friends. Here's another quote. This is from Cami Poole, age 10. She says, "If other kids out in public see Aiden acting the way he does, I get looked at as if I'm like him. I'm not like him. I'm a separate person, and I get really embarrassed." Um, so this is a perspective of a sibling, in those peer situations. And again, it shows that siblings do worry what peers will think of their brother or sister, and they might worry, as she does, that other people will think that they're just like their brother or sister with autism. So again, especially in that middle childhood and adolescent period, those peer issues can be very pertinent. Um, and siblings, they have a lot of strengths. We've talked a lot about potential challenges that they might face. But on the flip side, being a sibling of a child with special needs creates a lot of strengths and positive qualities. For example, siblings tend to be more compassionate and understanding regarding um, differences in other people. They tend to be mature beyond their years. A lot of times, siblings are very patient. Having a brother or sister with autism, it forces siblings to be patient and understanding. A lot of times, siblings have a lot of independence. They can make great leaders, and they often take pride in teaching their sibling. So there's a lot of strengths that siblings have, and these strengths should be reinforced and praised by parents as well as professionals who are working with the siblings. Here's another quote. This is from Micah. Let's see if I can pronounce this right. Quindazzi. And Micah says that having an autistic brother has helped me develop patience, tolerance of others, and an ability to use reason, which will greatly help me in my own life. The most important thing to remember is not to focus on the negative of living with a sibling with autism, but to strive to see the positives. Try to see them as a person and not as your problem. I really love this quote. And I think it's an important reminder of um, all of the positives that siblings gain from having a brother or sister with special needs. And although there can be a lot of challenges and a lot of negatives, it's important to also focus on the positive. So I'd like to go over a few things before we move on to questions. Um, as I mentioned earlier, a lot of times siblings can feel that they're the only ones that have to go through what they have to go through, and no one else and their peers just don't understand what their unique experiences are. So it's important to help siblings connect with other siblings who understand what their experiences are. We've started to have groups just for siblings at the Johnson Center here. They're called Sib Connections and Sib Camp. And really, it's a place for siblings to connect with other siblings who get it, who get what their experiences are like. Um, and I wanted to mention that we have a summer program called Sib Camp, which is a camp just for siblings of children with autism. It's held at the Johnson Center, and it's led by myself as well as Gina Martinez, our certified child life specialist. And it's a really fun week-long camp. It's from 9 a.m. until noon for 5 days. And it's a fun environment for siblings to get to know other siblings. We do a lot of fun and creative activities. And there's a focus on all of the important issues that we've discussed, such as understanding of autism, family issues, difficult emotions, and things like that. The group that we're going to be holding this summer is for ages 8 to 10. Where our date is to be determined, we're looking at midsummer dates. So check back on our website for the final dates. We'll be announcing that soon. But it really is a great chance for siblings to connect with other siblings. So I would encourage you, if you're not in our area, to look in your own area and see if you can find a sibling support group, um, or even, connect with other families who have siblings, um, so that the sibling can meet other kids um, who get with what they've been through. Here's a quick list. Thought I skipped a slide there. Here's a quick list of some books that I really like on sibling support issues. This first one, Siblings of Children with Autism, A Guide for Families. It's by Sandra Harris and Beth Glassberg. That's a great guide. The book that I got the quotes from the presentation today, is Siblings, The Autism Spectrum Through Our Eyes by Jane Johnson and Anne Van Rensselaer. That's another great one, and it's excerpts from siblings who have brothers with autism and their experiences. For younger children, the book My Friend with Autism, a coloring book for peers and siblings, is a great one. It's a coloring book, so it's fun. And then these down here are also good. Autism and Me, Sibling Stories, Everyone is Different, a book for young people who have brothers or sisters with autism, as well as My Brother Has Asperger's Syndrome. These are all great sibling support resources here. Here's a few websites. The Sibling Support Project is an organization just for sibling support of siblings who have brothers or sisters with special needs. They hold sib shops. Let's see if I put that. Yeah, I have a link over here. It's siblingsupport.org. But SIB shops are groups that are held in a variety of different states. And they follow a specific curriculum from the Sibling Support Project. But that would be a great place to look if you are trying to find a group for a sibling, would be to start with the Sibling Support Project. Here's a few other links here. A few websites. National Sibling Day is April 10th. Here's a quick link for the Autism Society of Greater Austin. And again, siblingsupport.org to find a SIB Shops program near you. And as I mentioned earlier, here are a few article references. I'm not going to go through all of these. I actually want to check and see what questions we've had come in. And before